Okay, good. So today I want us to look at catheter. This is very, very interesting for medical students, for people in residency training, whether you are junior resident or a senior resident. It's very good you know about catheters. Now, in terms of classification of catheters can be classified according to their sizes, according to their make, the materials that you use in making them, according to the number of channels that they have. These are the common ways that we classify catheters, even according to the retention mechanism, what is used in retaining the catheters. So these are some of the common ways. So the basic things you need to know about catheters generally. Now, I have on my table here different sizes of catheters. Now, we are going to look at Foley's catheter, Foley's latex catheter. These are latex catheters, and these ones that are transparent are silicone catheters. So, in terms of the latex catheters, you have different sizes. Now, I have on the table here, this is a size um, 18 catheter, size 18 two-way latex catheter. You see, it is the color code here is red. Um, the size 16 latex catheters are usually have a color code of orange. You know, so looking at this particular one now, this is a size 14. Size 14 here is green. So size 16 is usually orange. The color coding for size 18 is red. The color coding for size 20 is orange, yellow. This is size 22 two-way catheter. So 22 has a color coding of purple, and size 24. Since this is a size 24 catheter, see the latest catheter, it has a color coding of blue. So that's about that. Then you also have the smaller size catheters. You have I've talked about size 14, especially for pediatric surgery groups. You have a size 12 catheters, you have size 10 catheters, you have size 8 catheters, size 6 catheters. So if you come to the table here, you also see these other very small catheters. This is a size 6 catheter for the neonates, for the this size 6 catheter. So you also have this is a size 8 catheter. You see the color coding here is black. This is a size 8 catheter. You have size 10, you have size 12. So now, in terms of the material, the commonest materials are the latex and the silicone. So these are latex catheters. So these ones that are transparent, like I said earlier on, are silicone catheters. In terms of this makes latex catheters, patients react more to latex catheters. It's very, very, very rare to have a patient that will react to silicone catheters. So the silicone, like, as you know, as silicone as a material is inert. It's an inert material. So we prefer to use inert catheters, the silicone catheters for patients rather than the latex catheters. Except for a patient that has come and has been on a latex catheter and tolerating it's fine. But if you have a first time patient that is going to be on a catheter, it's better to place the patient on a silicone catheter. Now, in terms of another classification, we have one way, one channel catheters, you have a two-way catheters, you have three-way catheters. Now I have this is a one-way catheter, just one channel curved tip catheter. This is a one-way catheter. These one-way catheters are usually used for patients that are just on an intermediate catheterization. They put the catheter, urine flows out, they remove it, and then they still put it somewhere in their pocket, and then they still reuse it. Or if you have a patient that is in retention, just want to or that had a surgery, maybe under spinal anesthesia, you can just stick it in, urine flows out, you pull it out, and by the time the patient is going to be pressed again, he must have recovered from anesthesia. So one-way catheters are used that way. Now, two-way catheters has two channels. Outside the normal channel where urine will flow out from, it has a channel for retention. So the channel for retention, like like in this size 18 catheter now, the channel for retention is color coded red, and that means it's a size 18 catheter. So you have to usually put fluid, usually sterile water inside this channel, the catheter retention channel, to retain the catheter. When you inflate it, the balloon at the tip will swell up, which will now retain the catheter in the patient's body. So there are some other catheters that have other retention types of catheters. You have the Nelaton catheters and some other catheters that have different retention mechanisms. Foley's catheter is known for having a balloon assist retention mechanism. So there are some other catheters with other retention mechanisms. Now, let's say you have a patient that came in urinary retention. You can stick in a catheter, a size 18 Foley's catheter, and inflate the balloon and retain the catheter there. So now you have the three-way catheters. So if you talk about three-way catheters usually have three channels. Let me use this as an example. Now look at this three-way catheter. You have the central channel through which urine will flow out. You have the the catheter retention channel, the balloon channel. You usually inflate the catheter through this channel, and then you have the irrigation port. This is the irrigation channel. So when do we use three-way catheters? You can use three-way catheters in patients that have hematuria, patients that are bleeding, they have hematuria. You can also use it in patients that have pyuria, patients that have a lot of pus in their urine to irrigate the bladder. You can use it for administration of certain intravesical chemotherapeutic agents. So that's in a nutshell about three-way catheters. Now, in terms of these sizes, if you can help a patient with hematuria, patients with hematuria usually will prefer to use big catheters. And these big catheters starts from size 20. Let's say someone has hematuria, it is not be good to start using size 16 or size 18. It's better to use things like size 20 catheters, size 22 catheters, size 24 catheters. Those are the type of catheters that we will want to use for patients with hematuria, because the smaller size catheters can easily get blocked. Now, another thing is about the catheter tips. You have the straight tip catheters and you have the curved tip catheter. So you can see this one is a curved tip catheter. So for patients that have a big prostates, the curved tip catheters can easily slide through and enter inside the bladder compared to a straight tip catheter. So the curved tip catheters can ride on the prostate and enter the bladder. So these curved tips are usually meant to help overcome navigate areas that are obstructed. You also have what we call T-man tip catheter. T-man tip catheters usually have a stiff tip, and those ones can also help in navigating very narrow areas as well. So this is the first session on this catheter. We'll still have another session where we'll talk more about the indication for these catheters. Like I talked about, you have the latex catheters, you have the silicone catheters. You need to know these things. Latex catheters are there, silicone catheters are there, and we usually prefer silicone catheters to latex catheters generally. Thank you very much for watching this episode.